I guess I'll make one more video. Let's do this. We're going to be learning about drugs and gambling. Oh yeah. A substance use disorder is a term that applies to a person who not only consumes some form of drug, but it also must create some form of problem for the individual. So this can be risky drug use, social impairment, or the consequences of the drugs themselves. Before we can go further, we must first review some key terminology. First up, we have psychoactive substance. This is any drug or chemical that in some way affects your normal function of your brain. The next two terms are going to be abuse and misuse. Abuse, it's what you think of when you think of drug abuse. It's utilization of a psychoactive agent in a way that deviates from the normal medical pattern. Likewise, misuse implies some form of abuse. However, it differs in that in misuse, the drug was previously prescribed by a physician and is subsequently misused by the patient. And then lastly, we have dependence, which is repeated use of a substance despite negative consequence. And to do so implies some form of physical and or psychological dependence to the substance. These subsequent terms are pretty self-explanatory. We have intoxication. It's what you think of. Just know that it must affect one or more mental functions. Withdrawal, same thing you would think of. And tolerance is what you would expect for tolerance to be defined as. So people who suffer from some form of substance abuse will typically crave the drug, will display some form of psychological dependence, and will have diminished control over their drinking. And it's this last feature that is a key component of substance abuse disorder. These individuals lack the ability to control their alcohol consumption specifically. However, it's important to note that it is not abnormal for a person who abuses drugs to want to seek treatment in some way or another. It's just the ability to actually stop utilizing the substance that is difficult. Now, there are 4 different subdivisions of a substance abuse disorder, which we will describe in subsequent slides. Not only are there 4 subdivisions of abuse disorders, there are also 10 different classes of drugs that are frequently abused in the population. In order to be diagnosed with substance use disorder, the symptoms must be present for at least 12 months with a minimum of 2 signs in order to meet the criteria. Now, substance-induced disorder is any problem that arises after taking a drug or intoxication or a withdrawal or discontinuing use of a drug. So we all know about alcohol, some of us more than others. Nick? No, I'm just kidding. Anyways, so obviously the concentration, the volume, the presence of food in your system will affect how your body responds to alcohol. Now, the only other thing that maybe you might forget is the nystagmus that results after ingestion of alcohol. This is why cops will do that H pattern when they pull you over to try to elicit that nystagmus to see if there is alcohol in your system. Now, the long-term effects of alcohol are self-explanatory. If you need a review, go ahead and watch the show Shameless. It's on Netflix. It's probably better than listening to me talk on this PowerPoint, that's for sure. Now, moving on to tobacco. Short-term effects include an increased heart rate and blood pressure, whereas long-term effects include things like sleeping problems, difficulty concentrating, as well as mood swings. Now, amphetamines and cocaine, or as the cool kids like to call it, that white sugar, causes some short-term effects, which basically can be described as activation of the sympathetic nervous system. So if you think about the sympathetic response, you already know what cocaine does to you. Now, long-term consequences include psychosis and an increase in violent behavior. So we already have a good grasp on how opiates affect the body. They cause pupil constriction, they affect our digestive system in some way, and then in the long term, most severe consequences of opioid use are actually the result of poor lifestyle choices rather than the drug itself. So just take note of that. Now, hypnotics and anxiolytics become easy to understand once you remember that the benzodiazepine class of medications falls in this category. So short-term effects of benzodiazepines is everything slows down. You have slowed speech, slowed coordination, you have slower attention span, and you also have disinhibition of sexual and aggressive impulses. So those impulses slow down. Now in the long term, you have what's called discontinuance syndrome. And this is where if you've taken the drug too long, you could actually experience a worsening of the original anxiety. This is why these drugs are not often recommended for long-term maintenance in anxiety. Additionally, withdrawal of these medications can lead to reversal of that slowing we saw before. Now you're going to be speeding up, you're going to have irritability, you're not going to be able to sleep, and you're going to be restless. So if the actual action is to slow things down, withdrawal leads to the opposite, it speeds things up. Now the next drug is going to be cannabis. This includes marijuana or hashish. Uh, really the only thing that we don't already know about this drug is the term temporal disintegration. This describes cannabis intoxication where the person has trouble retaining or organizing information. Now the next class of drug is hallucinogens. Hallucinogens make people hallucinate. Now the most common of this class of medication is LSD. The next probably most popular is going to be MDMA. This is also known as ecstasy or the club drug. And then lastly we have PCP, which was originally developed as a painkiller. So painkiller PCP. Now the effects of hallucinogens are pretty self-explanatory. Of note though is that these drugs aren't typically taken continuously. So they're used often at special occasions, so at like concerts or at clubs. This isn't one of those drugs that people use all day, every day. There's also no withdrawal symptoms associated with hallucinogens. Lastly, people who take hallucinogens may also experience some form of flashback to their hallucinogen experience. Now, there are also other psychiatric disorders that are commonly associated with addiction. Most commonly, we have antisocial personality disorder, which was bolded for some reason, so maybe pay special note to that one. There's also mood disorders and anxiety disorders. It is also common for a person who suffers from depression or anxiety to be more likely to have a substance abuse problem. The epidemiology is pretty self-explanatory. Um, One interesting fact is that drinking alcohol before the age of 14 makes you more likely to develop future alcoholism versus those who began drinking at a later age. So apparently men are more likely to become drunks. Also, women are worse at holding their alcohol. It says here, a single standard dose of alcohol measured in proportion to total body weight will produce a higher peak blood alcohol level in women than in men. So I'm not just talking crap, this is science, guys. Now the prevalence of nicotine disorders, basically, nicotine abuse or dependence is very common. However, the percentage of adults in the United States who smoke has declined since 1964. With regards to risk of addiction over your lifespan, young adults are more likely to abuse illegal drugs, whereas the elderly are more likely to abuse prescription drugs. Social factors are pretty obvious. Now with regards to biological predisposition, a person who is born to alcoholic parents are more likely to become alcoholics in the future, regardless of if they're raised by those same parents or not. So biological factors, specifically regarding alcohol, is dopamine and the reward pathway. So alcohol can stimulate dopamine as well as other neurotransmitters, which will result in stimulation of the reward pathway and making you more likely to experience addiction. In summary, addiction is caused by a multifaceted integration system. So first, the patient initially experiments with the drug. This is further potentiated by increased access, the short-term positive effects like the dopamine pathway acts as a reinforcer for the behavior. There's also a small portion of genetic predisposition to addiction as well. And all this cohesively comes together to cause addiction in a patient. Now, for treatment of addiction, we have the most obvious first choice, right? Detoxification. Just get rid of the drug for about 3 to 6 weeks and let the patient just basically go cold turkey. Now, what commonly happens is the patient will enter withdrawal. Now, these withdrawal symptoms can be minimized by giving various medications as a way to decrease withdrawal symptoms. Now, there are also medications that can be administered while the patient is under detoxification. For example, disulfiram can be used to treat a patient undergoing alcohol detoxification. Now, this works by blocking an enzyme involved in alcohol processing. So when that occurs, your body's unable to process the alcohol, thus the alcohol is present in your system, resulting in severe unpleasant side effects. These can include tachycardia, chest pain, severe nausea, dizziness, flushing, and thirst. Overall, very unpleasant for the patient. Now, another medication that can be used while a patient is under remission or during detoxification is naltrexone. So naltrexone works to treat alcohol and opioid dependence. So it works centrally in the central nervous system on alcohol to decrease the consumption. Now, its role in opioids is a similar mechanism to how Narcan works. It's a competitive antagonist for muscarinic receptors. So what it does, it binds those receptors, and it's supposed to decrease your desire for opioids. So it sounds really great. However, before I get to that, it's taken once a month. It's given either PO or IM, and you only need to take it once a month. So that sounds really great. However, there are two really big points that I think are important to at least know. One, it's extremely expensive. It costs about $1,500 a month. And number two, so it says here on the slide, an opioid-dependent person should not receive naltrexone before detoxification. What it fails to describe is why. So what happens is, when a patient is on naltrexone, they are much more susceptible to opioid overdose. So if a patient who's on naltrexone decides to relapse and take an opioid, their threshold for the drug is significantly less than before. So they're much more likely to experience respiratory distress or respiratory depression and ultimately have a fatal drug overdose because of this interaction. And not only does this occur while the patient is on the drug, but for a certain period after they terminate taking the drug, or if they miss a dose of the drug. During all this period, the patient can have a fatal overdose on a much lower dose than the normal amount of opioids that they would otherwise be taking. So it's just a pretty big concern that I think it's at least worth knowing about. Now this next medication, funny enough, was spelled incorrectly. So you could see I kind of changed how it's spelled. It's actually called acamprosate. So basically this works by doing some stuff with chemical balance in your brain, which is supposed to decrease the amount of alcohol you're consuming. The benefit of this is that it doesn't cause a disulfiram reaction. So the patient has a much better experience with this drug versus the previously mentioned drug. And this drug is also co-administered with some form of behavior and behavior modification as well as counseling in order to help a patient stop drinking. There's also the classic Alcoholics Anonymous and their 12-step program. Unclear how well it works, but that's also an option. And the reason why it's difficult to evaluate its efficacy is due to a difficulty in following up with these patients. They're very likely to drop out. So who knows if it actually works, but they do it anyways. And there's also CBT. As I've mentioned in a previous video, thoughts affect emotions, affect behavior. Same general concept here. So in contrast to the CBT therapy, motivational enhancement, and the 12-step Alcoholics Anonymous therapy, basically all that matters is the ability for the patient to cope and their social support system. That's the best predictor of a good patient outcome. Now we're going to gamble. So for some reason, gambling is associated with substance-related and addictive disorders, and they also characterize two different types of gambling. There's social gambling, which I'm sure most of us do, which is considered recreational, and there's professional gambling, and this is considered an occupation. Pathological gambling is essentially affects ADLs and can affect their financial stability. Basically, gambling causes symptoms. To diagnose someone with gambling disorder, basically they treat it similar to an alcohol addiction. Tolerance is related to gambling in that the more money you spend to experience a same level of stimulation. So someone who makes a lot of money in gambling is going to require more money to satisfy that need. Additionally, they describe becoming annoyed when the gambling stops to a similar sensation to withdrawal. So gambling is more common in men. Now treatment, there's a Gamblers Anonymous, who knew? Patients should be removed from their environment. Makes sense. And then there's also an insight-oriented therapy, but that's only beneficial if the patient has been removed from their environment for at least 3 months. And if all else fails, there's always drugs. Probably an SSRI, but who knows, who cares? Well, I hope you guys are addicted to my videos, and go ahead and hit subscribe and like. Good luck tomorrow.